So today we will begin our session for mindfulness for chronic pain. We discussed a lot. We looked at some research on mindfulness of chronic pain and looking at some of the brain areas that were deactivated, in essence. The default mode network and the thalamus. The default mode network being these wave patterns, this activity in the mind that creates a sort of a self-referential experience of how we refer to ourselves from things that are happening to us. Things like wallowing in our pain was one of the beautiful examples that was given in terms of, well, we feel the pain, we feel the discomfort, we feel the sensation that hurts or that's stabbing. And then there's the wallowing in it. There's the ruminating. There's the catastrophizing that occurs. And with mindfulness, is there any way that as we become aware of our thoughts and emotions and the sensations, that we can actually decrease that wallowing? That as we become aware of what is occurring to us in the present moment, that there's actually a mechanism that's occurring in our brain that is causing that default mode network to be quieted, in essence, decreasing the wallowing, decreasing the catastrophizing, decreasing the ruminating, the self-judgment talk that comes up so quickly, and therefore changing or shifting our experience of the unpleasant sensation that's arising. We even brought up the example of like the two arrows, that the first arrow that is injuring us, let's say, is the sensation of the discomfort or the unpleasant sensation. Then there's the second arrow, which oftentimes is more potent and creates more suffering than the first arrow. And that second arrow being the wallow, being the despair, being the story that we've created around the pain, identifying ourselves as a pain patient, for instance. I am my pain. And hearing all the examples of, people and how they sort of worked with that or tried to say, okay, even though I'm feeling this sensation, I'm still going to try to go for a walk or go outside and breathe the fresh air and look at the sunset and sort of start shifting that sensory experience that is coming in. And in doing so, shifting our pain experience. So through the practice of meditation, mindfulness, being aware of the thoughts that arise, being aware of the sensations that occur, seeing if we can separate the sensation as a descriptive sense. This is what I'm feeling in this moment, sharp, tingling, numbing, whatever it might be, stabbing, even if it is severe, that we separate that from the meaning, the experience of pain and the stories that we tell ourselves around it. That as we practice this, we're actually deactivating certain areas in the brain that are responsible for those self-referential activities. okay? And that we can see pain or the discomfort that it causes is simply that. And we don't buy into the story. We don't buy into the identification of us being, I am a pain patient, et cetera, et cetera. We also talked about how mindfulness can actually help deactivate the thalamus, the major relay center, so that if the signals actually don't get to the brain, you don't feel them. Wouldn't it be cool if you had like, uh, in like photography, you can put like a red filter or an orange filter or a yellow filter, and you're filtering that, those wavelengths of light. What if, right, mindfulness could actually create this little pain filter for you in your thalamus that says, this unpleasant sensory experience that's coming from my elbow, I'm just choosing to not have that reach my brain. And then it's gone. It's literally gone. And this does happen to us. It may happen to us at fleeting moments throughout the day when our attention is so focused on something else, but we're not cognizant, we're not aware that we're not actually feeling that sensation of pain because we're so focused on something else. And then as soon as that focus disappears, for instance, maybe you're talking to somebody and you're having an amazing phone call with somebody, or you just got some really good news, or you just got some really bad news where all your focus is on that. And then that moment changes. And what happens is that you almost feel this cloud of pain sort of coming back. You're not aware of it in the moment because you're not paying attention to it. Literally, you're so focused on something else that those areas of the brain that go towards perceiving pain are actually perceiving something else and aren't paying attention to the pain. Right? We even had some examples of people being like, gee, I wasn't in so much pain until I actually started doing the exercise of paying attention to the pain. Now my pain is 4 or 5. We don't want you to do that exercise. We don't want you to pay it. If you're not in pain, we don't want you to try to go looking for it. That's really the moment where you come to your resource. And we did that practice, right? You find your resource and you simply bring your attention back to the present moment using the practice of mindfulness through your resource, through your anchor, through your breath. And that's it. As your mind wanders, and even as it wanders and it's sort of like, wow, I don't really feel my pain, you're not going to look for it. You're staying in the present moment. You're actually using your anchor to not go look for it. Because sometimes we actually feel so familiar with that unpleasant sensation, like it's a friend, and we're going to look for it. Like, where? I don't have that ache in my neck. Where is it? Right? And you're almost going to look for it, right? That's actually, right, in terms of like neuroscience terms, you're literally looking for it in your memory bank. You're going and looking for it. And as what happens when you place your attention towards it? You're actually creating neurons. You're creating little connections that are going to those different areas. Oh, there it is. Found it. You're like, oh, thank God it's not. Then you're, wait a second. I'm going to look for pain. I'm going to look for something that's discomfort. But it's so familiar to us that's when it's not there, we sometimes go look for it. So I have used these techniques of using my anchor, using my resource, that when I notice myself, for instance, going and looking for the pain, oh, I'm looking for it. Oh, come back to the present moment. Come back to this. Come back to my breath. Come back to feeling my feet on the ground. Come back to the repetition of a word, sound, or phrase, whatever you use as your anchor. And that's why we spent so much time on that, finding your resource and what that might be. Even if your pain is a 2 or 3, oh my goodness, my pain isn't a 5 or 6. And then all of a sudden you start thinking about it and that becomes a 5 or 6 because we directed our attention to that. And attention is like energy. And as soon as we put that, as soon as we go looking for it in our brain, that activates the areas of the brain, which then creates the pain experience all over again. Being just like a memory that we are choosing to activate over and over and over and over and over and over again. So oftentimes we say, well, if your attention is so powerful that it can really modulate your pain experience, that we have to really be careful of where we're placing our attention, where we're directing it. And that by directing our attention, we can actually modulate our pain experience. We can actually notice it increasing. Pay attention to the present moment. Pay attention to maybe our breath or other senses. And not necessarily believing and listening to all the thoughts that are arising, all the stories, and identifying with all the stories that are being created around our pain. And so we come back to the breath, we come back to the breath, we come back to the breath. We notice the story is being told. Oh, wow, look how quickly my pain story comes up. We notice how quickly that wallow. Today I want to wallow in my pain. Well, do I or not? Right? No, although this sucks and it's very uncomfortable, I'm just not going to wallow in it. I'm going to open up my windows. I'm going to, even if I have to crawl out to be outside, I'm going to smell some fresh air. I'm going to look at even if I can't get up, I'm going to look at the little bugs crawling on the ground. But I'm sending a different experience. I'm sending a different stimulus to my brain. Okay. One of the things that I've done in my mindfulness practice is, and this is kind of what we're gonna do a little bit today, is a combination. It's sort of a combination of two different techniques. It is a combination of slowly sort of expanding our awareness, for instance, so that if we pay attention, let's say my shoulder's hurting, if my attention goes to my shoulder, it's very likely that you can notice your pain increasing. Okay. And this is the analogy of, for instance, if all my awareness is a tiny cup of water and I put a spoonful of salt in this water and I drink it and I go, ooh, that's very salty. If my awareness is so focused on my shoulder, all I'm going to really notice is my shoulder pain. But if I increase the vessel and I still put a teaspoon or a tablespoon of salt in it and I drink it, but I have a bigger vessel, now the water tastes less salty. In fact, you might not even taste the salt. And so with the practice of mindfulness, by expanding our awareness, by including other things, for instance, in our awareness, we start to dilute that attention that always goes to the pain. It's almost like you're diluting the sensation of pain by including other senses. So you actively pay attention, for instance, to what you're listening to, or you actively pay attention to a touch. Like, yes, my shoulder's hurting. Let me actually bring my hand and make contact with it. And instead of paying attention to the pain, let me pay attention to the sensation of my hand touching or rubbing my shoulder. Okay. This could be analogous to using a TENS unit, for instance, like a trans-electric stimulation of the skin. What does it do? So your attention goes to paying attention, goes to the electrical stimulation rather than the sensation, let's say the stabbing sensation. So we bring our attention to, let's say, different areas of what we notice, not only the sensation of the uncomfortable, the unpleasant sensation, but also touch, or what I'm hearing, or what I'm smelling, or what I'm tasting, or what I'm looking at. And in essence, what we're doing is we're actively trying to expand our awareness so that we're including multitude of senses, therefore diluting the sense of pain. This can be a challenge to some because pain can be so grabbing of our attention, right? So like that pulling, it's like the biggest, brightest ad when we're driving down the freeway, and it just grabs her and it just pulls. It's almost like we become mindless in that. Oh my goodness, I want to go there. Okay. It grabs our attention so powerfully that it pulls us, but then we start to learn, oh, wow, look how quickly I went to that. Let me open up to other senses. How many other senses are there where I can't pay attention to other senses because this is grabbing? Okay, can you put like a mint in your mouth or listen to music? Or can you rub the area? Can you put your hand on your heart or on your eyes or on your head or a place that's soothing for you and feel that sense? And in essence, trying to create some space for the pain sensation to be held in. Right? If there's no space, that's it. We identify with the pain. That is all that is in our consciousness. That is all that is in our attention. That's it. It's sort of like if we were to draw an image of ourselves, our shoulder would be 90% of our body and the rest 10. Right? And then we go, oh, wow, look, it seems like in my attention and my awareness that 90% of my attention or 95% of my attention is going towards my shoulder. But what about the rest of my body? Let's welcome some of that in. Oh, let me pay attention to my left knee that's not hurting right now, or my left hip, or my foot, or my left hand, or whatever body part you can bring into your awareness. And slowly, you're taking that 95%, and maybe you're even just decreasing it by 1%. But that's just enough to start creating a little bit of space. Then what we can do is we can breathe. We can breathe into the area. Have you ever tried directing your breath to a certain body part? I'm going to breathe, and as I breathe in, you actually visualize the breath going to your shoulder or your elbow or your knee or your hip. As you're doing that, literally imagining as if there is space being created in the tissue to hold the breath that's coming in, right? Almost as if there's this constriction that's occurring, and with your breath, just see if we can just go, can we just paint the outside of the constriction? Can anything just get even a tiny bit into that constriction and open up? And allow it without resistance to simply see, can we direct the breath to that area, creating some space while simultaneously we're holding other senses to dilute the perception of pain. Okay. Now, again, a lot of these practices work if you are in pain. If you're not in pain, you don't have to do this. Okay. So I really want to be clear about that, because I don't want to bring on somebody's pain if they're feeling, if like, hey, you know what, I'm doing pretty good, and then all of a sudden you're like, oh, that sucks, I just, that practice brought on my pain. Okay, if you're feeling good, if you're not having pain, then simply just go to your anchor, go to your resource, and practice coming back to your anchor, coming back to your resource, whatever that might be for you. All right. So here we are, experiencing this opening, breathing into the pain, maybe affecting that area with other senses, touch, right? Maybe you put on a menthol cream and you feel the coolness of the menthol, whatever it is, but you're paying attention to the coolness of the menthol, not the achiness of the pain, right? You're actually choosing where you're placing this attention. Where am I going to, let me try to place it on the coolness of the menthol and opening and breathe into that area as I put my hand on that area and I'm paying attention to the other senses. Slowly and surely expanding my awareness so that the pain isn't the focus of everything. Because if it's the focus of everything, then we know what happens. And then, all right, on top of that, we direct loving kindness to ourselves, even directing loving kindness to that body part, that area that is causing so much discomfort and so much unpleasantness that some of us, I've heard people, I wish I could just cut off my arm. I'm in so much pain in my wrist, I wish I should just cut it off. And here we are then saying, okay, can we actually notice those sensations? Notice the thoughts and the emotions around those sensations that might be causing us the wallowing. That's that double arrow that's coming and causing us more suffering than just the sensation itself. Can we try to expand the focus of our attention to that area by noticing other senses that are occurring simultaneously? Maybe it's through touch. Maybe you have some aromatherapy. Maybe you put a mint in your mouth and you notice, or some music, and you notice a different stimulation, and you slowly increase your awareness of the sensory input that's occurring in this moment, as well as sending yourself loving kindness, sending yourself self-compassion, even sending loving kindness and wishing that body part well, wishing that body part to heal, wishing that body part to be free from suffering, wishing that body part to have, let's say, increased oxygen and blood supply so that the blood can bring nurturing chemicals and growth factors to that area to heal it if that's necessary. Okay. And even maybe just saying to yourself, man, this really hurts. I am hurting right now. And even that, can I be with that? And being okay with it. Sort of allowing yourself to just say, you know what? This hurts. This really hurts. And noticing what comes up with that as you're touching and sending loving kindness to that area. Okay. So it's kind of, you see how it's kind of a mixture of different practices that all comes into play. Sending your breath, opening up to various sensations, creating space in not only our attention, but in the tissues itself with our intention for that pain to not only be there, but for it to also move, as well as sending loving kindness, being self-compassionate, non-judging, even if we are wallowing, that we don't judge ourselves for the wallowing. I'm wallowing and I'm such a bad person for wallowing. Oh my goodness. Not only am I wallowing, but now I'm judging myself because I'm wallowing. So imagine being able to send pure love, pure light to that body part that's aching. I'm going to send pure light to you right now, using my breath and intention, expanding my awareness, noticing the birds singing simultaneously as I'm feeling the ache, noticing my feet on the ground, the sensation of my breath, sending loving light. Okay? This is to me the holism of mindfulness for pain. All right, where we're taking all these small little practices and sort of putting them together as one for the present moment. Okay, so with that, let's go into our practice. So let's find a comfortable posture, a position you will feel relaxed yet alert. And for this practice, you can be standing, sitting, lying down. You can even be walking, whatever is most appropriate for you. Closing your eyes if you feel comfortable closing your eyes. If not, having a soft downward gaze, as if you're looking off on the horizon over an ocean. And taking 2 or 3 deep breaths, and with each in-breath, bringing in the present moment, and with each out-breath, seeing if you can, oh so slightly, release any tension you feel in your body, and feeling your body become heavier and being more supported by the surface you're on. And then breathing regularly and bringing your attention to your anchor or your resource, a place that you can direct your attention to, that you feel safer, that there may be some peace. And as your mind wanders, coming back to your anchor or resource, as your mind wanders, simply coming back to whatever you choose to pay attention to. And that is a beautiful moment of mindfulness. The moment you recognize your mind has wandered, maybe your attention was grabbed and pulled by an unpleasant sensation. Maybe a thought or emotion or a judgment came in. And for this practice, simply noticing that and returning back to your anchor, returning back to your resource. And now, if you wish, if you have an area in your body that has an unpleasant sensation, saying if you direct your attention to that area, if you don't, then simply staying with your resource or anchor. As you notice the sensation, can you include other senses simultaneously? Can you notice what you're hearing? Can you notice what you're smelling? Can you create a little space in your awareness for this unpleasant sensation to be there too? Not focusing all of our attention on it, but simply noticing it. Not completely resisting it, but also not having it grab the totality of our attention. If you wish to touch that area of your body, such as your shoulder or neck, knee, hip, or back, or any area that is unpleasant, you can bring your hand up to that area and touch it. Feel the sensation of touch. Opening your awareness to not only include the unpleasant sensation, but other senses as well, simultaneously, that are occurring right now. Oh, so slightly increasing your awareness to multiple senses, as if somehow we could dilute that unpleasant sense without resisting or turning away from it. You may even use your breath with each inhale Breathe and direct your breath to that body part. Can you oh so slightly open that body part to receive the breath, even if it's just with your intention? Can that body part be opened with your breath, your intention, as you're noticing all the sensations that are occurring for you right now with what you're seeing, what you're smelling, what you're feeling and touching. Do you notice anything? If it becomes too intense, simply coming back to your resource. Paying attention to your resource. And then from your resource, opening up to include all your senses simultaneously. And also bringing yourself some loving kindness. Offering gentle compassion to yourself. This hurts. I am suffering. Even sending loving kindness to that body part. Wishing that body part well. To be at ease. To be at peace. And notice what happens. If you wish, placing your hand on that body part as well, or on your chest, heart, throat, eyes, forehead, if there's a place that feels comfortable for you. And directing loving kindness through your hands to that body part, to your whole body, directing loving and supportive light and healing through your touch. And through your practice, ever so slightly increasing your awareness to be able to hold your unpleasant sensation, this painful experience, more and more with a greater capacity of being. noticing where your mind is now. Coming back to your resource, coming back to your anchor. Seeing if you can increase your awareness to hold all the sensory information that is coming to you. What you're seeing, what you're smelling, what you're hearing, what you're tasting, and what you're touching. Can you include it all in this moment? Can you breathe into your body to whatever location you wish to direct your breath, to open up space for the energy to move and constantly flow, for blood and oxygen to go to that area, to bring new blood with growth factors and molecules that can help heal the area. As well as sending loving kindness to yourself, to that body part, wishing you well, wishing you to be free from suffering. All with self-compassion. And now, redirecting your attention to your anchor, your resource. Taking 2 or 3 deep breaths. Stretching if you feel like you need to stretch. Opening your eyes if your eyes were closed. And just taking a moment to reflect on your experience today. Yeah, it's very common and very difficult that when as you do these practices and your pain starts to lessen, that you start looking for it. Kind of like it's like a friend that is no longer there and you're looking for it. And we need to catch ourselves. The practice of mindfulness is also catching ourselves looking for it. It's like an old trait that we're so familiar with, and you're like, where is that? And as soon as you start asking that question, you're literally you're like, You're like, it's like it's like the Dewey Decimal System card catalog in the old libraries, right? When you go in, you just start looking through it, and that's what's happening in the brain. It's like, where's this connection? Where am I gotta find it, right? And every time you go looking for that, right? You go looking for it, then you're reinforcing those neural connections. And when we catch ourselves looking for it, it's like, oh, it's almost like you're halfway down the path and then you say, no, I'm going to turn. Like literally, like you're about to exit on the freeway and then you're like, no, you know what? I'm just going to stay on the freeway 3 more because I'm going to go down I'm going to take this other scenic route. And then you start reinforcing another pathway. And when you start reinforcing another pathway, then what happens to the little connections that go out here? They start to pull back. They're like, oh, we're not needed anymore. If you're not needed anymore, then you go and strengthen another connection. What's the connection that you want to strengthen? So as you do this, you might get to a point even in your meditation where you're like, oh, I'm coming back to my anchor. Oh, yeah. Like the pain may be morphed. Maybe some of you noticed that there was like a morphing. It wasn't as sort of static as maybe you imagine it to be. And so there's a morphing of it, and then it's like, oh, it's different. And then maybe it starts to spread and it starts to coalesce or spread or whatever it might be. And then it starts to decrease. And then it gets to like a 2, and you're like, is this real or am I making this up? Is this real or am I making this up? And then you're like, oh, I just asked that question. Now I feel it again. It can be quite distressing, to be honest with you. But it does happen. And so, it took me about 5 years, still in the process of not looking for it. Not looking for it. Every day I'd catch myself. Every day. So if you don't have it, don't go looking for it. If you do, then it's like you gotta, it's sort of like what. That's why we do, right? That's why there's no problem in doing or everyday practice, because there's always new tools, and even repeating the same tools, if you heard them a year ago or 6 months ago, doing them differently or hearing them differently or just practicing them 6 months later, you're going to have a sort of a different, there's going to be like different connections. And you're like, oh my goodness, that makes so much sense right now. I love this practice. And then you're like, wow, I didn't get it 6 months ago. And that's perfectly fine. Perfectly fine. Right? It's like teaching my 5-month-old how to walk, right? It's like every time that she stands, and I like let go a little bit, she's firing, right? She's firing her muscles and she's firing her neurons, but she's not going to walk, right? Then one day it's going to be like, oh my God, she's standing, right? And it's sort of like, oh, like her self 2 months from now isn't going to be like, oh, it was because of the work that I did 2 months from here, past that now I'm standing. It's like, I got it, woo, right? So it's the same exact thing. It's like every day, it's like those nerves are firing and those muscles are like activating, and she's pushing, right? And she's trying to stand, but then she falls. Nobody's saying, oh my God, you can't do it. You're never going to learn how to walk or anything like that. Right? And so that's the same thing with like using different tools, or maybe I'm holding her hands or holding her chest, or maybe she's pushing it up against my legs, maybe it's on the floor, whatever it is. It's all these different techniques to just fire those neurons, fire the neurons, activate the muscles. Okay? And so the more you do it, like if you work out your biceps and you just do one exercise with your bicep, that muscle is going to get strong, but you want to change the type of, maybe you do some wrist exercises and some elbow exercises as well to strengthen your biceps, because the biceps actually does a lot of this movement and not just this movement. So maybe you do some, all those sorts of things. And it's through repetition. And you come back to it over and over again, because you're going to get those neurons are going to fire differently, et cetera, et cetera. And great, excellent reminder and comment on that is, what pain does too is it's like all the focus goes to one area, and literally it's sort of like I was describing, right? It's like 90% of your attention seems like your whole body is your shoulder or your hip or your knee, but yet we completely forget about the rest of the body that's working so beautifully and that's doing all these miracles, right? It's like, and so thanking other parts of the body, being mindful of, wow, thank you, arm. If it wasn't for my left arm, I like, thank you for doing so much, right? It's like, oh wow, I can actually shift, and even that, right, shifting that attention to the other side, or to the heart that's beating, or to the lungs that are breathing, or to the blood that's flowing, and bringing oxygen, and removing carbon dioxide and all that stuff, is also, that can be part of that loving kindness aspect of it, like sending yourself loving kindness, and being grateful for that. So thanks for that. Yep.